The Gauteng Health Department says as the daily coronavirus infections continue to rise, the province has reached 91% of its bed occupancy rate. This is both in the private and public sector. Gauteng accounts for 60% of the new infections. Now let's discuss this further. We're joined via Zoom by Dr. Ntsakisi Maluleke, sorry for that, public health medicine specialist. Doctor, thank you so much for your time and for joining us this afternoon. Now, we've been told that the province is now in the eye of the storm for several days now. Just how bad is the situation in Gauteng?
Good afternoon, Onati, and good afternoon to the viewers. Indeed, Gauteng is in the eye of the storm. We currently have 4 out of our 5 districts having a bed occupancy rate that is above 80%. So that being City of Johannesburg, Sedibeng, Tshwane, West Rand. City of Johannesburg with a bed occupancy rate currently of 114%, with 1,492 COVID positive, as well as patients under investigation lying in on the 1,305 beds that we have availed in this particular district. And the other district that's been having high pressure is that of the West Rand, which has 483 COVID positive and PUI patients lying in the 515 beds that have been availed in that particular district, putting it at a bed occupancy rate of 94%. Sedibeng and Tshwane both have a bed occupancy rate of 83%. So indeed, we have bed pressures across the province.
Now, wherever you look, Doctor, South Africans are either, tweeting about someone that they know who has been turned away from a hospital. In fact, a tweet that I read earlier also from a Dr. Skosana saying a colleague has been looking for an ICU bed for her brother with COVID. He's been at Leratong Hospital emergency for more than 24 hours. No beds anywhere. Baragwana is full. Steve Miko says they don't accept patients outside their region. So now that we know that the situation is so bad, and we also know that the Nasrec facility was decommissioned, are there no plans to bring it back, considering the fact that there is a 91% bed occupancy rate in the province?
Onati, you will note that the Gauteng Department of Health has over 18,000 beds across different facilities within the province, and part response to be able to avail beds, particularly for the different COVID waves, has been repurposing beds within existing beds that we have. Currently, we've repurposed 23% of our beds across the province, and we continue to do so by ensuring that there is adequate health technology, as well as responding to the human resource needs that are called for across the province. So one other thing that we've also requested for facilities to do in conversations with them that we have on a daily is to ensure that there's collegiality in our working, where if one facility is having dire pressures, for the next facility to be able to assist them.
So just going back and referencing the tweet that I've just read, are hospitals turning patients away who don't specifically belong to that region? I mean, we've heard of desperate situations where patients are living in one region where that region is short of oxygen or short of beds. They then move to another region. Are hospitals turning people away because of that problem? And what are patients expected to do?
One of the principles that guides us as a health sector is from the Constitution, which says that everyone has the right to access health care. It is a principle that we emphasize across board. So no facility should be turning away any patient, irrespective of which region they come from, irrespective of whether they've got funds or not. So, access to health care is a constitutional right.
Now, Doctor, if you can just bring us up to speed in terms of the vaccination process in Gauteng. We obviously know that one of government's plans was to fast-track vaccinations because of the dire situation that the province finds itself in. What's the latest there in terms of vaccinations?
In terms of vaccination, we've been taking guidance from the National Department of Health. It's been a phased-in approach based on literature. One will note that the first cohort of vaccinated people were healthcare workers, and currently we've been vaccinating the over 60s, and we've opened up the EVDS for the over 50s to vaccinate, while the teachers are also being vaccinated. And as new literature arises, policymakers from national will then advise accordingly, and as province, we then take guidance from them as to which next cohort we need to vaccinate.
Now, one of the interventions that this province has done is that you've deployed the SANDF medical members to assist with the rising COVID-19 numbers. So talk to me about how that is going so far in terms of their assistance, because we're also hearing in some quarters that nurses who are sitting at home are saying that government is not utilizing them, nor are they utilizing interns as an example. Talk to us about that process.
In terms of the South African National Defence Force human resource capacitation, they've been assisting us in opening up additional beds in the Chris Hani Bara alternative building technology. And one challenge we had, which we've ironed out now, was accommodation for this health personnel. They are now being housed at the Charlotte nursing quarters so that we can bring in more SANDF staff to be able to assist us. And to all the health personnel who are sitting at home, unemployed at the moment, we have been on a recruitment drive across the province. First phase of our recruitment drive has been in our new structures, that of Bronkhorstspruit and in Carltonville at Anglo Gold Ashanti, and also for the ABTs at Chris Hani Bara, Jubilee, and Dr. George Mukari, in order to ensure that we increase bed capacity in those structures. 477 posts were availed for those particular structures, and the facilities have been having walk-ins. They've also been having recruitments from CVs that have been on file, as well as from previous post advertisements for posts. So we have been recruiting. And to anyone who is sitting at home, we definitely need your assistance, especially in those facilities. And for the other facilities across the province, we are now in discussion with the various CEOs to avail additional human resource. And I'm sure that those nurses who are sitting at home, not working currently, will avail themselves either through the nursing agencies or as recruitments through this process to be able to assist us in the fight against COVID.
Dr. Maluleke, we know that in Gauteng specifically, we haven't reached peak yet. But I mean, in the last reporting cycle, we know that the numbers shot up to over 11,000 infections in a 24-hour cycle. Talk to me about the next couple of days. Lockdown level 4 was supposed to ease, hospital occupancy to some extent. When are we likely to see this peak, Gauteng reaching a peak, first of all? And also, what are we looking at over the next couple of days?
Over the next couple of days, Unati, our numbers will continue to rise as we have not yet reached our peak. The call for citizens of Gauteng to stay at home, to adhere to hand washing, social distancing, wearing of masks continues and cannot be overemphasized. Our modeling team has recommended that we may reach peak within the next 2 weeks should people adhere to the current lockdown regulations.
All right, Dr. Maluleke, thank you so much for your time. And that's where we have to leave this interview now. Dr. Ntsakisi Maluleke, public health medicine specialist. Well, there you've heard it, South Africa, or at least Gauteng. We have not reached our peak just yet. The numbers will continue to rise over those next 2 weeks. I mean, just in the last 24-hour reporting cycle, Gauteng had numbers over 11,000 in just one day. So please be safe and stay at home if you can.